Okay, so today we're going to talk about something that, well, it touches every single one of us, but honestly, it's often the hardest thing to bring up: end-of-life care. It's a deeply personal journey, so let's walk through what it really means to navigate it with clarity and compassion.
So let's just dive right in with the big question. How do you want to be cared for at the end of your life? Just pausing to really think about that is the most important first step. It's about shifting from feeling powerless to feeling empowered, and it all starts right here.
And that is the whole point of this. The goal isn't about giving up. It's about taking control. It's about making sure your final chapter is written on your terms, and that your voice is the one that's heard and respected every step of the way.
All right, so to really get a handle on this, we first need to understand the landscape. What are we even talking about when we say end-of-life care?
So here's the official definition, and you'll notice there's a really important shift in focus here. This kind of care isn't about trying to win an unwinnable fight. It's about changing the entire objective from finding a cure to ensuring the best possible quality of life, centered completely on comfort and peace. Okay, so what does that actually look like? Well, it breaks down into these four main goals. It's not just about the physical stuff, like managing pain. It's also about honoring your choices, supporting you emotionally, and really just aiming for a tranquil passing. It's a whole person approach. You know, making these kinds of decisions can feel huge, overwhelming even. That's why it's so helpful to have a framework, kind of like an ethical compass to guide everyone involved: you, your family, and your doctors. And here they are. These 5 principles, they're really the foundation of all medical ethics, but they become absolutely critical in these situations. They help create a balance between what technology can do and what a person actually wants done. Now, of all those principles, I really want to zoom in on this one, autonomy, because this is the big one. This is the game changer. At the end of the day, the message is simple. It's your body, your life, so it has to be your call. This principle is what gives you the power to say yes or no to any treatment, making your voice the most important one in the room. Okay, so having a voice is crucial. But what happens if you can't speak for yourself anymore? How do you make sure your wishes are still heard? Well, that's where these practical tools come in. These are called advanced directives, and you can almost think of them like a voice memo for your future self or an insurance policy for your healthcare wishes. They're legal documents that spell things out so your loved ones aren't left guessing or arguing during an already stressful time. And these directives usually come in 2 main flavors. A living will is the what. It spells out exactly what kind of medical treatments you do or don't want. The durable power of attorney for healthcare, now that's the who. You're picking a person, a surrogate you trust to make decisions for you. Honestly, having both is the best way to cover all your bases. All right, another really important one you've probably heard of is a DNR, or a Do Not Resuscitate Order. Now, there's a huge misconception about this. A DNR does not mean do not treat. That's not it at all. It's a very specific instruction for a very specific moment. If your heart or breathing stops, it says to prioritize a peaceful death over CPR, but all other comfort care continues. So having the paperwork sorted out is obviously super important, but that's only half the battle, right? There's the human side of things. How do we actually talk about all this stuff without it being a total disaster? Well, in the medical world, doctors often use a framework called the Spikes protocol to help guide them through breaking bad news. But honestly, take a look at these steps. This isn't just for doctors. It's a fantastic guide for any of us having one of these tough conversations. It's all about setting the stage, listening first, and leading with empathy. It's a roadmap for compassion. And, you know, in these conversations, the words we use matter a lot. There are some terms that get mixed up all the time, and that confusion can cause a lot of fear. So let's tackle a big one, because this gets to the heart of a major ethical line. First up is something called palliative sedation. And look, everything here comes down to one single crucial word: intent. The intent here is to relieve unbearable suffering, like pain that just won't respond to anything else. The goal is symptom management, plain and simple. Now, on the other hand, you have euthanasia. The intent here is different. The direct goal of the action is to end the person's life in order to stop their suffering. Getting this distinction right, that it's all about intent, is key to understanding the whole ethical and legal debate around these choices. Okay, so we've talked about the ethics, the legal tools, and the conversations. How does this all fit together to actually achieve that goal of a good, dignified experience? Well, it basically comes down to this simple formula.
You take your ethical compass, you add your practical toolkit of documents, and you combine it with clear, open communication. And what do you get? You create the conditions for a death that is peaceful, respectful, and truly in line with your values. So, if you're going to remember just a few things from all this, what should they be? First, plan ahead. Please don't wait for a crisis to have these talks. Second, remember your autonomy. You have the right to make these calls. And third, none of it matters if you don't talk about it. It all points to the same North Star, a final journey focused on comfort and dignity.
And that really leaves us with one final thought, doesn't it? We've seen that the tools are there. The legal forms, the ethical guidelines, it all exists. But maybe, just maybe, the hardest part isn't filling out a form. Maybe the biggest challenge of all is simply starting the conversation.